This is a recording of the acid-base balance, and this is the concept of acid-base balance. So acid-base balance is critical to homeostasis and optimal cell functioning. To maintain acid-base balance, hydrogen ions must be kept in a relatively narrow range. Acids release hydrogen ions in a solution, and bases, which are alkalis, accept hydrogen ions in a solution. So hydrogen ions determine the acidity of body fluids, and this is measured as pH. The relationship of your hydrogen ions and pH is an inverse relationship. And so as an example, you have an increase in hydrogen ions, the pH falls, and the solution becomes more acidic. So you have increased acidity. Just the same as a decrease in hydrogen ions causes a rise in the pH and decrease in acidity. Your normal pH of body fluids is 7.35 to 7.45. Metabolic processes in the body are continuously produce acids, which falls in two major categories. Your volatile, which is carbonic acid, is eliminated from the body as gases. Carbonic acid breaks down into carbon dioxide and water. All other acids are considered non-volatile. They must be metabolized or excreted. An example is lactic acid, hydrochloric acid, phosphoric acid, and sulfuric acid. There are three systems that work together to maintain the pH in the body. These are your buffer systems, respiratory system, and renal system. First, we'll talk about the buffer systems. Buffers prevent major changes in pH by releasing hydrogen ions. They bind with hydrogen ions when excessive acid is present to help minimize changes in the pH. They release hydrogen if the body fluids are too basic or alkaline, thus restoring the pH. They act very quickly, within a fraction of a second. There are three major buffer systems in the body. You have your bicarbonate carbonic acid buffer system. Your bicarbonate is a weak base and your carbonic acid is a weak acid. They work together to keep the pH normal. So if bicarbonate is depleted, the pH drops to less than 7.35 and acidosis occurs. If the carbonic acid is depleted, you will have a rise in the pH of greater than 7.45 and alkalosis occurs. The other buffer systems in the body are your phosphate buffer system and your protein buffers. Looking at the respiratory system, it regulates carbonic acid by eliminating or retaining carbon dioxide. Carbon dioxide is a potential acid when it's combined with water, and so that makes it carbonic acid. Increases in carbon dioxide or hydrogen stimulates the respiratory system. It will increase both rate and depth of respirations to try to help compensate. Respiratory system does act within minutes. And so this increase in rate and depth of respirations increases, which eliminates carbon dioxide and carbonic acid. It also increases the pH to a normal range. In alkalosis, there is decreased rate and depth of respirations, causing a retention of carbon dioxide, which The carbon dioxide will combine with water to restore carbonic acid levels and bring the pH back to normal. The renal system is responsible for long-term regulation of acid-base balance. The kidneys normally eliminate non-volatile acids that are produced during metabolism. The kidneys also regulate bicarbonate in extracellular fluids. The kidneys' response is much slower to changes in the pH. It takes hours to days for the renal system to help the body compensate. They can selectively excrete or retain hydrogen to maintain the pH. The PaCO2 measures pressure of dissolved carbon dioxide in blood. Your normal is 35 to 45 millimeters per mercury. Less than 35 is called hypocapnia. Greater than 45 is called hypercapnia. Your PaO2 measures pressure of oxygen dissolved in plasma. Your normal is 75 to 100 millimeters per mercury. Less than 80 is considered hypoxemia. Your serum bicarbonate reflects regulation of acid-base balance. Normal level is 24 to 28. Sometimes you'll see a little bit variation in that level as well. All right, continuing with the renal system, you have your base excess, which is also called BE, is a calculated value. It is also known as buffer base capacity. Your base excess is essentially a measurement of the increase or decrease in bicarbonate. It does reflect degrees of acid-base imbalance by indicating the body's total buffering capacity. Your normal value for base excess for arterial blood is +2 to a -2. Acid-base balance is assessed by measuring arterial blood gases. All right, so concepts related to acid-base balance include communication, cognition, fluid and electrolytes, perfusion, and oxygenation. And there is more detail that includes nursing interventions on page 5 of your textbook if you are so inclined to review that. So alterations in acid-base balance, there are two major categories. You have acidosis, which you have an increase in hydrogen ions above normal, and so your pH will be below 7.35, and that is an acidosis. In alkalosis, you have decreases in your hydrogen ions, and so your pH is above 7.45, and that puts you in an alkalosis state. All right, and so this is just kind of showing you your ranges, and you can see if you get too high or too low, that creates a problem and is incompatible with life. All right, so metabolic is primarily changes in your bicarbonate concentration. In metabolic acidosis, this is when the pH is less than 7.35 and your bicarbonate is less than 24. And this can be developed from abnormal bicarbonate losses or excess non-volatile acids in the body. Your metabolic alkalosis is an excess of bicarbonate in relation to hydrogen, and you will have a pH greater than 7.45 and a bicarbonate greater than 28. All right, respiratory primarily are changes in retention of carbon dioxide, increasing carbonic acid. Respiratory acidosis occurs when you have a retention of carbon dioxide and an increasing amount of carbonic acid. It's usually caused by hypoventilation. pH is less than 7.35 and your PaCO2 is greater than 45. In respiratory alkalosis, you will have an excess of carbon dioxide. excess loss of carbon dioxide. This is usually caused by hyperventilation. Your pH will be greater than 7.45 and your PaCO2 will be less than 35. Acid-base disorders, further defined as primary or mixed. Primary, they usually just have one cause. It's also known as simple. An example would be respiratory failure, often causes respiratory acidosis. Your mixed is a combination of respiratory and metabolic disorders. Example would be a cardiac arrest, and develops mixed respiratory and metabolic acidosis due to lack of ventilation and retained CO2, and hypoxia of body tissues, and that is from anaerobic metabolism. So that's metabolism without oxygen. Compensation. Compensatory changes occur to restore the normal pH and homeostasis. Changes in respirations occur within minutes of changes in the pH, but becomes less effective over time. Your renal responses take longer to restore pH, but they are more effective long term. So basically, the respiratory system kicks in first. By the time it's pretty much spent, the renal system kicks in to further help the body compensate. All right, so pH, when the pH returns back to normal, then you can say that the disorder is fully compensated. When the pH is still outside normal limits, it is considered partially compensated. Risk factors for acid-base imbalances occur usually in critically ill clients. Metabolic acidosis occurs in clients with insulin-dependent diabetes mellitus and chronic renal failure. It can also occur from severe diarrhea. Can occur at any age, but your children and your elderly are going to be at increased risk because of their water content. Metabolic alkalosis occurs in clients in acute care. Your older clients are at increased risk due to their fragile fluid and electrolyte status. Respiratory acidosis. Clients of all ages are at risk when alveolar hyperventilation occurs. Those with COPD are going to be at greater risk for chronic respiratory acidosis. Respiratory alkalosis. Your older adults and younger children are at risk with large doses of salicylate ingestion, which is aspirin. It is often misdiagnosed in older adults because its early symptoms, hyperventilation, and altered mental status are attributed to other disease processes. Nursing assessment, you want to get a health history that includes their current prescribed as well as over-the-counter medications. You also want to get complementary therapies, and that's going to be vitamins as well as herbal supplements that they're taking. Physical assessment is going to be vital signs, including pulse oximetry. It is important to correlate their pulse oximetry with their ABG results. Lifespan and cultural considerations. Infants and children are at higher risk for fluid and electrolyte imbalances because of their immature kidneys and they can't concentrate urine. Infants have high respiratory rates, which can lead to insensible losses. Your older adults are going to be at risk for fluid and electrolyte imbalances because of decreased kidney function, thirst sensation, and levels of intracellular fluid. They also have more comorbidities that contribute to electrolyte imbalances. Diagnostic test, ABGs are going to be done. An Allen's test should be done before ABGs are drawn, and this measures radial and ulnar patency. And I've got some pictures I'll show you here in just a second how to do that. You want to evaluate acid-base balance and oxygenation. All right, blood drawn for ABGs is done by a respiratory therapist, some of your healthcare providers, or it could be nurses that have specialized skills. They're usually intensive care trained, and so they have to have additional training to be able to draw ABGs. The arteries that ABGs are drawn from are high pressured, so pressure is held for about 10 minutes after the ABG test is done. It will be held longer than 10 to 15 minutes if your patient is on anticoagulant therapy. And this will help prevent hematoma formation in that area. So this is how an Allen's test is done. And so basically you occlude the ulnar and radial artery, have the patient clench their fist, and so their palm will be blanched, and once they open their hand, they will not have any color in their hand, and then you will release the ulnar artery, and their hand should pinken up, and you're still occluding the radial artery, and that means that they have collateral circulation, and so it is okay to do ABGs from the radial artery. If they do not have collateral circulation and you develop a hematoma in the radial artery, then they have no blood flow to their hand, and that could cause them to lose their hand. And so this is a picture showing you how when both arteries are occluded, how the hand is blanched, and then when you release one or the other, the hand should pinken up, and that shows collateral circulation. All right, interpreting ABGs is done through a systematic approach. You want to evaluate each individual measurement and analyze the interrelationships to determine the client's acid-base balance. So these are some steps in interpreting. So you want to look at the pH to see if it is high or low, to see if you're in alkalosis or acidosis. You want to look at your PaCO2, so you're looking at that level to see if it's high or low. You can look at the pH and PaCO2 relationship to see if they're the same or opposite. You also look at the bicarbonate level, and then you evaluate that as well. You also look for compensation, which is you're looking to see if you have changes in not only your carbon dioxide, but your bicarbonate as well. See if the body's trying to compensate. You're looking at the pH to see if it has gone back to normal, which would give you a fully compensated ABG. You're going to also look at evaluating the oxygenation of your patient, and that's looking at your PaO2 level. So interventions in therapy, the goal of treatment is to restore or maintain normal body balance. Treatment depends on identification of the underlying cause. Collaborative care also is dependent on identifying the underlying cause. Health history should include conditions related to a person's culture as well as their developmental stage. Independent interventions are going to include daily weights, monitoring INO, assessing respiratory and renal function, maintaining a patent airway, monitoring their oxygen saturation. Independent interventions also include measurement of their vital signs, assessing level of consciousness and neurological function, prompt reporting of changes in your client condition. Collaborative interventions, thorough client history, including vital signs, risk factors, any cardiac, renal, pulmonary problems, any current medications, medical conditions, and symptoms. Critical information may be gained from family members of a client if they're in severe distress. So you want to include recent eating habits, any history of vomiting. Ongoing collaboration is going to require the entire healthcare team. Pharmacologic therapy, goal in acidosis is to reverse the effects of excess acids in the body. You want to return the pH to normal levels quickly. For acute acidosis, administration of sodium bicarbonate infusions if their bicarbonate level is low. You want to monitor for signs of alkalosis, which could mean you have overcorrected the pH. Hold medication and notify the healthcare provider if this occurs. Symptoms of alkalosis, which will be overcorrection of the pH, include irritability, confusion, cyanosis, slow respirations, irregular pulse, and muscle weakness. All right, nurse's role in administration of sodium bicarbonate therapy involves monitoring your client's condition, analyzing ABG reports, assessing the client for symptoms related to acidosis. Symptoms of acidosis include sleepiness, coma, disorientation, dizziness, headache, seizures, and hypoventilation. You want to assess for causative factors, which could include diabetes, shock, and diarrhea. Judicious use of sodium bicarbonate is going to be important. Contraindications are going to be clients with cardiac and renal disorders. Doesn't mean that they will not give it to them, but it needs to be very carefully monitored because these do contain sodium, and sodium is bad for patients with cardiac and renal disorders. Other uses of sodium bicarbonate are going to be to alkalinize the urine and speed the excretion of acidic substances. This could be from overdose of aspirin and phenobarbital. Usually in chronic renal failure, when kidneys are not excreting hydrogen ions, they may use sodium bicarbonate. Sodium bicarbonate use in home remedies is the use of baking soda, and it's used to relieve heartburn and sour stomach. This could lead to systemic alkalosis if it is overused. So client teaching is regarding sodium bicarbonate. You want to contact the primary healthcare provider if gastric discomfort continues or if it's accompanied by chest pain, dyspnea, or diaphoresis. Using non-sodium antacids. Do not use any antacids for more than 2 weeks without consulting the healthcare provider. Intubation if they are in respiratory distress. So if the PaCO2 is greater than 77 millimeters per mercury, a PaO2 of less than 60 millimeters per mercury, and pH less than 7.20, a lot of times they are intubated for this. Chronic hypercarbia, you want to correct that slowly. Quick correction may cause metabolic alkalosis. This can be due to excessive retention of bicarbonate. Hypoxemia may require supplemental oxygen. This is just a quick review of your levels. And you can see how this one has your bicarbonate level of 22 to 26, which is the one that I usually am more familiar with, but your book has it being 22 to 28. And then just another funny. So this is the end of this lecture on the concepts of acid-base balance. So if you have any questions, just let me know.